record this. Let me hit record first. There we go. Um, so I had a chance to review the benefits guide. It is very basic to me. I don't see anything out of the ordinary. One thing that's unique that you do have is the LTD situation where the can be employer paid or not.
Yeah, that's definitely something that's going to cause confusion.
Okay. Is that a new item this year?
It is. Yeah. So,
Okay.
I mean, essentially the way, so this is Tina, sorry. So far in the meetings that I've been hosting, the way I've been communicating it is the way that it's currently offered is employer paid, which means if you have to go on LTD, it's then a taxable benefit. Yeah. Whereas this coming year, you can keep it that way, or you can choose to pay it, you know, because if you foresee at some point in your life having to go on LTD, where then it becomes non-taxable. So, and I really just, I put it out there. I feel like it kind of has gone over most people's heads.
Yeah.
But so the current situation is that it's employer paid. Mm-hmm. Therefore, if you actually use it, it's taxable.
Okay. I mean, it makes sense to me. I mean, that's very, that's a nice option, really. I mean, you're giving them the option and they can make their election either way. So that's nothing crazy. That's not a huge curveball or anything. It's certainly something we can explain when we're at the meeting. So I saw we'll go into the benefits in detail as well, and I'll actually lead this and you can just chime in or stop me or correct me or whatever you want to do. But I'm going to go benefit through the guide first, and then we can take a look at the system. Or, in fact, since we have Jason on, would you like to do the system first? And then we can go there?
I can, yeah, I have Jason on for support on my end, but I can go into the system.
All right, I'm going to give you...
This is our tech system that I can, yeah.
I'm going to give you control then.
Okay, give me 1 second.
Okay.
Getting my login here. I know. Okay. So I have control?
I'm giving it to you now. So you should get a notice that you're presenter now, and there's a button to share your screen. There it goes.
Okay. Does everyone share my screen? Okay.
Yeah, we see it.
Okay, so this is the test environment. So going in and taking you through an enrollment.
Yeah, and I logged in with the credentials that you gave me, and this is kind of the landing page. This is the first page you see, basically.
Mm-hmm. Mm-hmm. Okay. I'm just gonna pick an employee here. 1 second. Going here. Okay, so when you get here, you're scrolling down to open enrollment. And you're going to select on open enrollment here. So we're going to shop for benefits. Just hold on just a second. I don't want to leave the meeting. I was just trying to make this smaller here so I can see. Okay. So I already went into this person's record, but basically, here's your menu of options of what you can select for at open enrollment. So it's pretty intuitive. You go in here. We have the dependents here. So you would take someone through and say, obviously here's what dependents we have on available. Here's our 2 plan options. So obviously, click here, we want to view the plan. Just so you're aware, if they want to edit anything, you would go in here to edit. So you would unclick people if you don't want them on, or click people if you want them on. I'm just going through, it's kind of basic. So I would hit confirm. And just stop me along the way if there's any questions.
Well, I have a question right now. So is the current coverage displayed when you go into the medical plan already? Is it already there? And then you're just making updates to it at this point?
Well, I'm in test, but Jason, how would it look in production? Would it just say, it would just give you your select a plan, right?
Right. Well, we're not loading the medical plans from last year. Yeah. So it would just bring up the 2 plans as being available, and you can pick the one of the 2.
Okay, just curious. Thank you.
Okay. Okay, so we're done with this one. And then I can go back to open enrollment here. And if I wanted to go back and change, this probably wasn't a good example because I already processed an enrollment on this person.
Yeah.
But this is the only, But if you wanted to, again, same thing, you would just hit update cart. And here is their voluntary coverage. So they're already enrolled, but if they wanted to select more, they could, and they would get an EOI. So if I hit this, they're going to get evidence of insurability. So here, I'll update my cart. And then here it launches a PDF saying, hey, you need to fill out this EOI if you want to go ahead and proceed with this selection and getting, applying for this coverage.
Yeah.
So this actually needs to be printed out and completed and returned according to the instructions to Uno.
Okay, so during enrollment, that's going to be cumbersome. I mean, we're not going to be able to hook up to printers or anything.
Right.
Can the employee come back in here and do it later? I mean, we can notify them they need an EOI.
Yeah, because at the end of, Jason, correct me if I'm wrong, but at the end of the enrollment, right, if they go back in, there's like things you need to do.
Yeah,
in here.
If you hit the home button in the upper left.
Mm-hmm.
This person, I think, had elections, right? So scroll down a little bit. Did this person have elections that had EOI?
Yeah, I just saved it.
Okay. Well,
But I didn't confirm my enrollment yet.
Yeah,
So I'm going to still shop for my benefits.
Right.
Okay, so I'm continuing my enrollment. When we're done.
When you check out with that there, when you get to the confirm page at the end, you'll see the to-do list. And then if you go back to the home page at any point, so if they leave and come back in, they'll be on the home page. Once you've checked out, we can take a look at it.
Okay.
Okay. So I'm just going to put transit in here quickly. Hold on 1 second. decline.
Quick question on those. Quick question.
Sure.
If you wanted to update the information on the beneficiary,
Jason, where is that in here?
So once I need to look at the plans, we may have it set where it's optional for admins. Could be why we're not seeing beneficiary info.
Okay.
But if it is required for an employee, once they get down, like they'll make their elections, and before they check out, it'll make them apply their beneficiary data. And then at any point, if they want to change that, they can either come back in while like the OE window's open, they can come back into the OE window, or over on that left-hand menu where it has profile, Chrisanne, if you click that, there's a section for my beneficiaries. So don't click there now because you'll get out of here.
I don't want to get knocked out. Yeah.
But the employee can always come into the system right anytime during the year and go into the My Beneficiary section and adjust their beneficiaries.
got it.
Okay, before you check out here, Chrisanne, can you just scroll up to the top? So this looks like a summary of everything, benefit by benefit by benefit. And the changes that you've made are indicated here. So this, because current coverage will not be loaded, we have to go in each product and either accept them or decline coverage, as you have done in some of these here. Correct?
Yes.
In order to be able to check out.
Correct.
If you go down a little bit, so that's the AD&D, spouse life, child life, parking reimbursement, and transit reimbursement. We'll cover this when we get into the benefits, but yeah, I didn't see them pop out of the guide, so we'll take a look at those. And then down below you have the LTD. Can you show us the LTD, because we want to see that options there.
Of course. So we put the text here in red so that it would kind of jump out at you.
Yeah.
Showing that you have the two options on whether you want to, do taxable or tax-free.
Okay, well, that's pretty simple. Pick one of the boxes.
Yeah. Right, pick one. So in here, I'll just pick this one for, the sake of picking it.
All right, so you're selecting the product or declining the product, you're updating the cart, and you move to the next product is basically how this goes.
Correct.
And then what's below LTD then?
What's that again? Sorry.
I was just asking, what's below LTD? So you have basic life insurance, company paid benefit, AD&D company paid, and then the sup life, which does require the employee. So on the supplemental term life, here's a question. So we also manage a platform of our own internally, and I know that, so if you don't have the current coverage loaded here, isn't every employee going to be triggered for EOI no matter what they choose, even if they already have it?
No, because we have the guaranteed issues in the system.
I see. So is this a new carrier by chance, Unum?
It is. It is.
There you go. There you go. Okay. That makes sense. So you have total cost per pay period. You click checkout. Effective 1/1.
So here, here's all your coverages. And it's like, it shows who's covered, start date, the coverage level that you have, what you're paying, the plan.
Yeah, basically a summary, and you have a choice, it looks like, to even go back at this point and edit it one more time. I click and change plan there.
Mhm. Yep.
Okay.
And if you scroll all the way down here, you'll hit checkout.
Okay.
Right, and just to jump on here, right, until they check out,
Yeah.
right, their benefits aren't saved. Right? They're not,
Okay.
let's say, 100% complete their enrollment until they check out. And then anytime,
Like you need to see, yeah. Sorry,
Yeah,
Jason.
yeah, just you need to see this screen to know that you're 100% done. And then anytime they can, right, during the OE window, they can always come back in and make changes. Just if they come back in and make changes, they just have to check out again after making those changes. Otherwise, they won't be saved.
Okay.
Yeah, there's that to-do list we were talking about.
And if you click, are those links that take you to those items directly? Oh,
Yeah,
okay.
it's going to be that EOI pop up again.
Okay, yeah, great. So this is actually great because we can show the employee, you remember I told you that you needed EOI. When you come back in, here's exactly where it's going to be under your to-do.
Yep, it'll be there on their confirm if they go into the window, or if you hit that home button now again, Chris-Ann, you'll see the to-do list is right there too.
Okay. Do employees get an email confirmation of these elections or no?
As long as we have an email address for the employee in the system, when they log or when they complete their enrollment, when they hit complete, right, check out,
Yeah.
they'll get an email to that email address.
Okay. And is this system new to the employees or are they accustomed to using this?
It's new, right?
It's
No
new.
one's using it. Yeah.
It is new. And then regarding logins, I mean, we're logging in here as an administrator in a test environment, but Chris-Ann, during the actual enrollment, what are we doing? Are the employees giving us their information to log in with, or how are we proceeding there?
They are. They need to bring their login with them.
Okay.
And their login is their employee ID. So I believe the first scheduled group of people that you're going to visit is in Bloomington.
That's right.
And those folks will be provided their login information. So when they come to you all to enroll, they will have their login information.
Okay. Perfect.
And then alternatively, inside benefits guide, just so you're aware, is not that you'll be doing this, but if they have a problem logging in or need having trouble with their login, there's a phone number inside the benefits guide, the employee engagement, the Fer Engagement Service Center.
Okay.
Where they can call to, if they're having trouble with their login or need a password reset.
Okay. And then the link you provided here for enrollers that we're using for the test environment is that actually the live link as well, or is that different?
No. This is test. It's not live.
Test. Okay.
How inside the benefits guide here.
Yeah.
There's instructions on the link you need to use and how to enroll.
Yeah, I saw that. I didn't know.
It's on page 4.
Yep, and we'll go through that here as well. Okay. So regarding the system, I think those are my questions. Mary, do you have any?
I don't. No, wait, I do actually. Where is the?
Mary, we can't hear you. Sorry.
Email.
We still can't hear. I can't hear you.
No, I can't hear you either.
Can you hear me now?
There you go.
Yes, thank you.
No, I'm sorry. On the personal, is there a personal information page where we can update the email or look at the address for the employee or phone number if somebody has an address change? I didn't see that.
So when
no.
Well,
yeah, go ahead, Jason. Sorry.
Yes and no. So the screen that we're on right now, right? This is where when they're first going to go into the UltiPro system, and then they're going to single sign on into the Benefits Prime system. Right? And I think, Chrisanne, those are the steps you have in the guide, right?
Mm-hmm.
Yeah.
Yeah.
The land on this page, all right, and I'll have that button there. Right now it says view confirmation, but it will say like, shop for benefits, or I forget exactly what it says. So they'll click there to get started, and then the first two steps it's going to make them go through is check their employee profile. So if you hit that profile button.
Right, but just so you're all aware, I don't know if you were on the call with us, Jason, for Fair Value, which is the folks that in Bloomington and Franklin Park, Mahela had to shut that piece off because we don't want, there's testing going on, just for lay of the land, just so you all know.
Yeah.
Ultimate is a new provider to our Nestle family that we acquired, and we're going through a payroll conversion, which is going live January 3rd, and that's going to be their first paycheck out of this Ultimate system. So there's been testing going on, and we don't want the employees obviously to see the testing that's been going on in the profile. So they will not have that opportunity to change their address or to update email.
Right. But
sorry, go ahead.
Yeah, hit that profile button on the left-hand menu.
Sure.
Yeah, and then my profile.
Mm-hmm.
So after they hit the button to start their enrollment, the first screen is going to take them to is this, where it has. Now they're not going to see every one of these fields. We're seeing them all because they're set to be visible to the admins, but they're going to see some set of this information. Now we see an edit information button here, but they're not going to see that. Again, we're seeing it as admins.
Okay.
They can't, any of the information that's in here, they cannot change in Benefits Prime, right? This feeds over from UltiPro.
Gotcha.
So if there's, right, I think like what you're saying, Chris, is that subset of employees, right, they're not going to be able to go into UltiPro and adjust their address. But like the Ferrero folks, right? I guess if they have a question, do they want to say reach out to HR about updating information, Chrisanne?
Yes.
Okay.
And then for the other locations, we would tell them to update their information in a system called UltiPro.
Right, and that's the only other location that is possible with is Canton. Because Canton's already on UltiPro and getting paid out of the Fannie Mae. So just a note there. Mm-hmm.
Okay, so I noticed in the guide the link is actually going to UltiPro to start for the employee to log in, and then it comes over here. Are you able to show us that part, Chrisanne, at this point, or not?
Not right now. There's no connection.
Right, because we didn't turn it on yet because there weren't people going in there.
Right, and it's not turned on in production until it won't be turned on until Monday, and there's no connection between the systems in tests, which is where we're at right now.
At this point, I see. Okay. All right. Does anyone else on my team have a question about the system before we let Jason go and review the benefits? No?
Okay.
Okay.
Yeah, no, that's fine. That's great.
All right, Jason, thank you. Chrisanne, I'll take control back over and we'll go through the benefits guide in detail.
Sure, and and then I'm going to bring Tina back on for any other questions.
Okay.
Jason, thank you so much.
You're welcome.
For your help.
Yep.
I'll be in touch after. Thank you.
Yep.
I have one question. I'm sorry. I got a question before Jason goes.
Yes.
Beneficiaries, if they're adding somebody that's not currently in the system, I was looking through the guide of the plan source, and it states in there that they have to have Social Security. So if somebody sits with us and puts a dependent in that it does not have a social, what would you like us to do there? Is the system going to stop us, or what's going to happen?
It's going to require a value as you go through. Now you can trick it with like 9s if you do that, but I would highly recommend like tell the employee as soon as you have the social to go in and update it again. Because what's going to happen is
Yeah.
we could trick the system here, but then we're going to send that information over to the carriers. So like, the medical carriers are going to get that. They're going to see 9. And in a lot of cases with the EDI files to them, they're going to kick that back out. And it's going to come back to the team to go and get anyway. So unless that employee wants to get harassed, like, hey, we need that information, right? And it may impact them, right? Like their medical benefits, because it may not be loaded into the system, or their dependents' medical benefits, for instance. They can get through the enrollment by sort of putting a dummy code in, but as soon as they can, best case is always go back into the system and update that. And then that can be done even after open enrollment. They can go into that family, my family right there, Chrisanne, right above my beneficiaries. They can come into this at any point during the year and they can edit. Now they're not gonna have the option to remove, but they're gonna have the ability to edit, like review and edit the dependent. If they need to make a change to that dependent, right, on coverage or something, that's a life event. They'll be able to come in and change their social if needed.
So it's fair to say that we can go ahead and use 9999 and then let them know that they need to come in at one point before the end of open enrollment or after and add it, or they won't have coverage.
Correct. Yeah, just to make sure that there's no issues with the information going over to the carriers. I would tell them that.
All right, thank you.
Yep.
All right. Thank you, Jason.
You're welcome. All right, I'll talk to everyone later.
Bye-bye.
Bye.
Thanks, Jason.
Okay.
Yep.
All right, I'm going to take control over again here, and let's start at the top here with the benefits guide. Let's just go page through page, and Christine, I'll just kind of cover these items. Please add anything you want to my spiel here. Stop me, correct me.
Okay.
You want. Let's go through the whole thing. So first is just a table of contents. There's a lot of extra information, not really benefit information, but eligibility, domestic partners, and so on. Other information, compliance and stuff is at the back of the document. We're going to focus here on the benefits here. All right, so medical, 2 plan options, consumer-driven health plan with an HSA, or you have a PPO. And we'll go into more about that as well. It does say that Ferrero pays most of the cost of the coverage. You pay your share on a pre-tax basis. There is also an employer contribution to the HSA. Prescription drugs included with the medical, Blue Cross and Blue Shield, dental coverage, Delta Dental. You and Ferrero share the cost on this one, pre-tax basis. Vision with VSP, you pay for that one pre-tax. 401k, now, I didn't see 401k in the system. Is this the time of the year for them to make elections, or can they do that at any time of the year to make changes?
So that's not happening during the open enrollment period.
Okay.
I say that and I can't help but laugh. So that's going to have its own enrollment period in the coming weeks. They will be getting much more in-depth communication about the plans that are being offered. There's very high level information about the plans being offered right now to all of them. They're going to be getting, they're going to be able to enroll with Mass Mutual. At that point, they'll have rollover information should they desire to roll over their current plan. But it is not going to be part of the open enrollment that's coming.
Okay. HSA, obviously, if they're participating in a high deductible plan, they can contribute to an HSA. And like I said, there's an employer contribution. It's down farther. FSA, if they have the PPO plan, they can contribute to a flexible spending account, which of course is to put the pre-tax dollars aside for your medical expenses. And then dependent care. For dependent daycare is normally what the use is. Most people max that one out at $5,000 a year. So that's that. Life insurance. So company paid basic life insurance, 2 times salary up to $500,000, and then separate AD&D company paid 3 times salary up to $500,000. Very nice.
Yes.
Supplemental term life, 1,000 up to $1 million, depending on who you're covering. You do pay the entire cost of that. This is the one that requires the evidence of insurability.
Yep, and the catch with this is that the employee has to be purchasing supplemental life insurance before you can purchase for any dependent.
Okay. Does the system stop you from electing spouse life without employee, or is this something we have to keep an eye on?
No, the system will stop it unless it was grandfathered for some of the Nestle people.
Okay. Short-term disability. So 7-day waiting period, 26-week benefit period. That's a company paid benefit as well. And then long-term disability. So this is a little different, probably the first time I've seen it. So after your 26-week benefit period on the SCD, this one kicks in. And does this pay until normal Social Security retirement age? The LTD?
Does that pay the regular retirement age?
Yes.
Okay. So they have two options. You guys saw this in the system already. So they can pay, the employee can pay for it themselves if they want to, or it's paid for by the company already. So there's a good definition here. It says you have the option to pay the premiums yourself. Should you file a claim for LTD, the benefit is tax-free. The benefit is tax-free to you if you pay the premiums. If the employer is going to pay the premiums for you, which is an option in the system, that's fine.
Mm-hmm.
You could be taxed. Let's just say you will be taxed.
No, you will be taxed if you leverage the benefit.
On the benefits.
So the catch is if the employer pays and you end up using the LTD, it's a taxable benefit. If you pay and you use the LTD, it's a non-taxable benefit.
It makes sense. It's very clear to me. Okay, that's the LTD. These other items aren't in the system per se. Oh, hold on. David had a question. He says, can they change this option each year? So they get employer paid this year. Can they next year at open enrollment change it to the other one, or vice versa?
Yeah. Yeah. I mean, open enrollment opens the window to make changes to everything. So yeah.
There you go. EAP, Employee Assistance Program through Unum, 24/7 access, confidential for lots of personal matters.
Mm-hmm.
Advocacy services help to understand your benefits, resolve healthcare claims. That's a nice feature. Wellness resources, achieving and maintaining a healthy life. And then when to enroll, the open enrollment dates, what the new hire eligibility is. So it's first of the month after 30 days for new hires. In case you're sitting with one, you could. Let's see. Now, I didn't see, well, let's just keep going. Let's just keep going. So how to enroll. So this is the actual link. It's not active yet. I just checked. So this is the actual link you'll use to enroll with, and then the employee will log in, and then up will come plan source. And then these are very specific instructions on how to actually enroll. If you are not paying attention here today, we have the recording and resources outside of this, but this is a step-by-step instruction on how to do this. Also, for the 5 in Bloomington, I will be there with you on Monday. In fact, I'm picking most of you up at the airport, so we got some windshield time together to review this as well. Making changes during the year. If they have a qualified life event, these are the events, and then how to do so. And then now we get into the details. So the 2 medical plans, consumer-driven health plan, high deductible plan, whatever you want to call it, and a PPO. So obviously the deductible is going to be higher on the high deductible plan than the PPO. So $2,500 versus $500. And then family, what's the asterisk on the family? True family aggregate, entire family deductible must be met before any benefits are paid. There you go. So if you have family coverage, you have to meet the entire family deductible first. As we all know, with a high deductible plan, you have to meet your deductible first before any benefits are payable. And then they're payable at, for the most part, 80% coinsurance in network. With the PPO plan, of course, you meet your deductible only if it applies, and you also have 80% coinsurance after that. But most things are going to be copays. Primary 25, specialist 35, excuse me. Yeah, here's a deductible. So labs and x-rays, 100% covered in office. So some doctors' offices have x-rays and MRI machines. So it's covered there. If you have to go to a facility, though, you're going to pay 20%, which is fair. Inpatient hospital, 20%. So does the deductible, Chris Ann or Tina, does the deductible apply for hospital services? Do I have to meet my, oh, it says right there, after deductible is met. Okay. So you go in the hospital, now you're going to have to pay your $500 deductible first, and then you have 80% coinsurance. Outpatient, same thing. Emergency room, emergency care, after deductible is met, unless otherwise noted. So this has a $100 copay, no deductible on the PPO plan. So if you go to the emergency room, you pay $100 copay, and that's it. Urgent care, $40 copay. Of course, on the high deductible, these are all 20% coverage. HSA contribution, so it doesn't apply to the PPO, but if they enrolled in the high deductible plan, depending on the tier they enrolled in, they get an employer contribution of $750 or $1,500. Now, Chris and Tina, is this, how does this get deposited? Is this all up front, or is it split out per pay period? How does that work?
For the HSA?
Yes, for the employer contribution.
So the employer contribution is paid twice a year, once in January, once in July. The employee contribution above and beyond the seed is taken per paycheck.
Yeah, that's what I was going for. January and July is when you make your deposit. So you're just cutting it in half, right? Splitting it in half. And then with the HSA, is there do they get a debit card, or what's that process like?
They're getting a debit card.
Okay. All right. And then prescription drugs, 10, 30, and 60. So $10 for generics, $30 for formulary brand name drugs, meaning that it's on the Blue Cross list of drugs in their formulary. And if it's not in that formulary, it's $60. And then for mail order, yeah.
Are the prescription drug copays going towards the medical deductible max out of pocket? The copay, I'm sorry. The copay for the
prescription. So the copays on the PPO do apply to max out of pocket.
They do apply. Okay.
No, on the PPO.
Thank you.
Okay. And then mail order, they get a 90-day supply. They get a break on the copays. So that's nice. The rates are here as well. Lots of more additional information on the HSA and the FSA here as well. There's the FSA. FSA is use it or lose it. So let's talk about that for a second. So they have to use up everything that they contribute towards the FSA. Does Ferrero allow any carryover at all? Some groups let them keep $500 towards the year.
So no, there's not a carryover. You can't have a carryover if you have a grace period. Ferrero offers the grace period. So the grace period for 2019 claims goes to the end of the first quarter, so March 31st. 31st or 30th, wherever the hell March is.
Gotcha. Okay. Use it or lose it. All right, dental plan.
Is the grace period,
Go ahead, Mary.
is the grace period for to hand in and get reimbursed so they can take the receipts for 2019 up to March 31st and still get reimbursed?
Wait, say that one more time?
For the flexible spending account, if they have receipts for 2019, is your grace period, does that mean that they can take some of those receipts and they still have time to submit them in 2020 all the way up until first quarter, March 31st?
Exactly. So the grace period allows them the extra quarter of time to submit claims expenses for the prior year, not for 2020. It's only for the 2019 year.
Perfect. Thank you.
And then Lisa Mills had a question. Do you have a limited use FSA? So if I'm contributing to the HSA, can I have a limited use FSA, or do you not do that?
No, there is no limited purpose FSA.
Okay. All right, dental, one plan, in and out of network, $50 deductible. Usually only applies to basic or major services. Preventive services covered at 100% with no deductible. $1,500 annual max per person, which is pretty nice. Orthodontia, 50%, $2,000 lifetime maximum. Children up to age 19. It says it right there in the header. And then the cost for that. For the vision plan, one plan with a VSP, in and out of network. Frequency, 12-12-24, so one eye exam a year. Lenses once a year, frames every 2 years. $10 copay for the eye exam. Basically $25 copay for the lenses. And then you have other options here too. You can get tinting and so on. And $130 allowance for frames, which is pretty standard. Contact lenses in lieu of frames, also pretty standard. And that's about it on vision. Let's see. Dave, is there a late entrant rule for dental or vision? Sometimes there's a waiting period on those benefits. Do you have that at all?
We have a waiting period on our button.
No, it's first day.
Okay. Yeah, some employers have plans where if you enroll in the dental plan, you can get preventive services right away, but basic and major services you have to wait a year. But that doesn't apply here.
That's not how this plan is treated.
Okay, great. Paid time off, paid parental leave, vacation. Again, not really their benefits, but they're not what we're enrolled.
Don't go there.
Okay.
Don't go there. Just stick to the stuff we're rolling in the plan.
There you go.
No, because it'll cause more questions that you might not be able to, refer them back. But
yeah. All right, employee life insurance. We already went over this: 2 times salary or 3 times for AD&D. Supplemental life. Evidence of insurability. There's a whole definition there. If I go back up to the top, there's the AD&D definition. Dependent coverage. Short-term disability. We talked about it. LTD, we talked about the 2 options. 401k, we're not going to go into that either. And then resources. So these are all the websites. They need to look up a provider, and then phone numbers for everything as well. And then required notice. Yeah.
Scott, STD, is there a 10-month waiting period for pregnancy, or is there no waiting period?
Tina,
What was that person on?
there was a question about, a plan question about STD, about there being a 10-month waiting period for STD for pregnancy.
No.
No waiting period. Okay.
No waiting period. Discriminatory now.
Yeah, I'm just gonna. Sorry, I'm flying through this, but I'm gonna look for what
No, it's okay.
I know these are just compliance documents, but I'm looking for something specifically that I didn't see here. And no, I don't see it anywhere. So one of the benefits, two of the benefits that I saw that were listed, and maybe I just skipped over them here, was parking and transit. No, they're not here. So can you explain to us, I mean, it looks like they're just setting aside a dollar amount.
A dollar amount for what? I'm sorry?
Yeah, so the question, I didn't see anything in the guide here at all about the parking or the transit. Two items.
The commuter?
Should we have a,
Is it ready for 1-1? Because that's going to have to be a separate communication.
Yeah.
No, I would leave it alone right now because I think we're still working through the implementation piece of it.
yeah, should I have Jason suppress it?
Can they pick it now?
Well, it's in there to pick it, but should I have him suppress it?
Well, I mean, if
Somewhere.
they can pick it, then
Yeah,
let them pick it.
all right.
Otherwise,
Yeah,
but we have there's no
communication
communication
on
on it. I mean, it's pretty self-explanatory. If they have questions, we're gonna ask.
Yeah. Yeah.
Well,
Okay, sorry guys, you just got outside there.
okay. So tell me, what is it? What is the parking benefit and what is the transit benefit?
I don't even know.
So I can send you information on it. We literally just had our kickoff with them
like a day ago.
And I'm like rushing to get what is it, plan, like all kinds of
all the documentation over to him.
Should we have them suppress it and do a separate
Enrollment.
Yeah. I actually can do that.
We can leave it open and then do a separate option, like when we're all.
No, I can't.
I don't like that either.
Can't do that.
Then I would say suppress it.
All right, I'm suppressing transit.
Transit and parking.
And we remember this.
Yeah, I'm gonna suppress it.
Both of them, right? Parking and transit?
Correct.
Okay. All right, thank you. So we've gone through all of the benefits. Actually, there was a question. Let's see. Is the Horizon, this is from Lisa Nielsen, is Horizon Blue and Blue Cross Blue Shield carrier? What are you asking, Lisa?
So Blue Cross Blue Shield is the carrier. Horizon is local. That's in New Jersey. The network is the national PPO/EPO network. So the legal entity that we have our contract with is Horizon Blue Cross Blue Shield, but it's the Blue Cross Blue Shield Blue Card network. So anybody outside of Jersey has a full access to the national network.
Okay. I think that answers it. And then let's just talk logistics for a while here. This is for my team mostly. So let's see here. So I've got the schedule here. You got it, Lisa? You guys all have this. You've had it for some time. Like I said, I'm meeting you all. So tab 1 is for the first 5 people. I'm going to meet you all in person there at the airport. We'll have some windshield time. I'll be there day 1 in the morning at least, and then I have to head out. The details of them, though, if you click on the consecutive tabs here, let's skip that one for now. Let's go to Bloomington. So there's 2 shift times, 6 to 8 and 2 to 4. At that one, there's the address, estimated head count of what we're looking for, about 300 employees. And this one's actually broken up over a couple sessions. So we're actually coming back the second week as well. Franklin Park, address is here. We're targeting about 200 employees. There's 3 sessions. You're pretty clear there. Canton is different than the others because they have very specific requirements in terms of the dates and the times and so on. So that's not till the second week. We'll address who's going where on that one at a later time. Actually, they're defined here as well. So Armando, 6 a.m. to 3 p.m. There's your lunch, and it tells you exactly where to go and so on. But we can review this later. But there's a schedule. I included it in the training invite as well, just for your reference. Of course, you've seen this many times already. I did include this very generic plan source document, self-service enrollment guide, in case it could be helpful, just as a backup to the backup to the backup. I mean, you've seen the demo. We have the recording. I'll share that with you after this. And then it's very clear in the enrollment guide, or excuse me, in the benefits guide, how to enroll. So you probably don't need that at all. And then we have the actual guide itself. So I included in the training invite the benefits guide, the plan source document, and the schedule. And this is really all that you need. All of your travel arrangements have been made, or most of them have been made. Certainly your flights have been made. And then Olena sent out a note earlier today about the car rental thing where we're going to commute together. So basically, that's all been established. You can work with Olena or myself on that. So that's just all logistics, really. But because I'll be there in person to kick everything off day one, I'll make sure that you guys get logged in and everything is started, and I'll be there the whole first session. So now, Chris and Tina, will either of you be in Bloomington during this time, or is this just us?
We won't be in Bloomington. Yeah.
Okay.
The local contact will be there. Nicole Johnson and Scott Goheen are HR folks there.
Nicole and Scott. Let's see. Do we have their? I don't know that we.
So just so you're aware, send a note. They're fully aware of like that you're all coming and who you all are
And
and all
everybody's
that.
names and
Yeah.
locations, yada, yada, yada.
Okay. Okay. Good. Excellent.
And then, Scott, you have my cell phone number in case, something goes crazy.
Yeah.
You can call me.
Yeah.
So
I don't know that I have.
I'll be available.
That's great. I don't know that I have all of the contacts at the locations information. I don't remember.
Okay, we can send it to you in an email.
That
We'll
would
send
be
it to you.
fantastic. That would be great. And I'll reach out to
Yep.
Nicole and Scott probably tomorrow, just to give them a heads up. And
Yeah, just if you're
find out
emailing
those-
them, just keep Tina and I on copy so
Okay.
we know what's going on and we can call if they're not responsive or something.
Okay, sure. I'll do that. Just those little specific questions like what door do we go into? Is there a special place to park and all those good things? Is there, by the way, while
Right. So when you roll up,
oh, sorry, go ahead.
go ahead. No, I was just going to say about Bloomington, when you get there, it's basically, it's off the highway and there's like a circular, whatever, roundabout in front of there's visitor parking right there.
Visitor parking, okay.
So it's very simple to get into Bloomington. Now, Franklin Park's a little different. They have a guard station that you have to check in with first.
Okay.
And they may require you to watch a very short video because it's a safety video because you're entering a plant.
Yeah.
So depending on what time you're starting, I would try and plan for that to be there a little bit beforehand so that you don't get caught up in all that.
Yes. Okay. Yeah. Generally, this is what we do, so we're always early, but in that case,
Sure.
a little extra early. Are there any other security requirements? Obviously, we're going to have ID. All of us are flying, so anything else we need to know about security or getting into locations? while we got the team here?
No, just that you have your, just as you stated, as long as you have your photo ID, you're fine. That's what I had to show the last time I went over there.
Okay. All right. Good. Good. Okay. Excellent. So we're right at an hour, and I think we've covered everything. We've certainly gone through all of the benefits, went through the system pretty extensively. I think we have what we need on our side. Is there anything to add, Chrisanna or Tina, for the team before we part ways here?
I don't think so. But if you, like I said, you have my contact information. You know, don't be shy. Just call me if something's not going well or.
Okay, sounds good. And where are you located? Are you in Canton or Franklin Park?
No, Tina and I are in Parsippany, New Jersey.
Oh, okay. New Jersey. Okay.
We're at we're in Ferrero, USA, the North America corporate headquarters.
Gotcha. All righty. Well, excellent. Well, for my team, thank you so much for joining. Again, I've recorded this. I'll zip this up and send this to you later this evening. And of course, my cell phone's on my email. You guys all have my cell phone. Just call me between now and then, and with any questions or whatever it is, logistics and travel and so on, all those good things. And we'll see some of you on Monday. Thanks, everyone.
Excellent.
Y'all have a good day.
You too. Thanks so much.
Bye-bye.
Thank you.
Thanks, Scott.
Thank you, Aiden.